All right, hello everybody. We'll give everybody a second to come in and get settled. We're super excited to talk to you a little bit today about faith and about OCD. So as folks come in, feel free to tell us your name, tell us where you're from, where you're viewing from, and we'll give everyone a second to get settled. You know, we have some awesome panelists here today, and we're really excited to talk about faith and OCD and some of the really exciting initiatives of the IOCDF coming up. Again, as folks are coming in, feel free if you want to share where you're from, if you want to share your name, why you're here. We're so excited to have you as you all come in. All right, we'll take about 30 more seconds here and then we'll jump in and get started. All right, well, welcome to our Faith and OCD During the Day Town Hall that we're really excited about, excited to share a lot with you. Just a quick disclaimer, this town hall is intended to serve as educational content and is not intended to replace therapy. For treatment-related questions, please be sure to work with your local provider or contact a local clinician. The International OCD Foundation is not a crisis hotline and should not be used if you are in distress or feel unsafe. If you're in a crisis or if you ever feeling suicidal or unsafe, please go to your local emergency room, call 911 or call the suicide prevention hotline at 800-273-8255. And just a quick reminder, this is a safe space and we want folks to be able to feel free to share and to comment. We always in this space want to be respectful of others. We always want to be kind and we want to create as safe a space as possible. And just as I always tell my students when we're discussing faith, we all have different experiences, both with faith and with OCD. But I think we can really show empathy by recognizing that someone else's diverse experience is just as important to them as ours is to our own life. So I hope we get to carry that into our conversation today. So really quick, my name is Katie O'Dunn. I'm an ordained minister serving as the interfaith chaplain and religious studies chair for about 2,700 kiddos in an Atlanta private school. So I'm in my office during lunch right now, so do not be alarmed if there is some level of chaos that ensues during our time together. But I also have OCD, and after a relapse a few years ago, where my OCD made me question every single aspect of my identity, my ministry, and my life, exposure and response prevention really saved me, and really trusting this process helped save me. But it also prompted me to be much more open about my struggles, much more open about the things that I navigate so that individuals know clergy can struggle too, and that evidence-based treatment and faith do not ever have to be mutually exclusive. So I have a big passion for letting those of all faiths know that they're not alone. And I really love learning every day from the beautiful faith traditions of my students. I have students who are Jewish and Christian and Sikh and Hindu and Muslim and Jain and Buddhist and students who affiliate with no faith. And I love learning from these students every day. And so much of my passion for this work in mental health and faith comes from my love of these kiddos and wanting them to know that they're not alone. So that's a little bit about me, and I'm excited to introduce you to some of our awesome panelists today. So today we have Jed Siev, who is an associate professor of psychology at Swarthmore College and a licensed clinical psychologist. Previously, he directed the Anxiety Treatment Center and founded the OCD and Related Disorders program at Nova Southeastern University after completing training at the Massachusetts General Hospital and the University of Pennsylvania. Jed's research focuses on information processing, judgment and decision-making, and metacognitive processes involved in maintenance and reduction of OCD, hoarding, and anxiety. And he has a particular interest in unacceptable thoughts and especially scrupulosity. He is currently writing a book for Oxford University Press on how to treat scrupulosity. So Jed, we're excited to have you here for this conversation today.
Thanks so much. Great to be here.
Yeah, absolutely. And then we have Valerie Andrews, who is one of our awesome lead advocates this year, doing so much of our amazing work on OCD and faith. And Valerie is a retired school teacher and full-time wife, mother, and amazing grandmother. So following her OCD diagnosis in 2011, she began advocating in hopes of bringing awareness and inclusion within her own community and communities of faith. And today she spends the majority of her time focusing on her new nonprofit, Miss Mabel's Sparrows Incorporated, which is a nonprofit for women of age, color, and faith. And her goal is to continue working as an IOCDF advocate and promoting change. So Valerie, we're so excited to have you here today. And then finally, we have Micah, and so excited to have Micah, who graduated from high school in 2008 at the top of his class with nothing but a promising future. However, when his OCD and comorbid hoarding disorder and depression became symptomatic shortly thereafter, he soon found himself unable to complete college or retain steady employment. After many years of disillusionment, Micah began to slowly gain traction in his life after several months of ERP therapy in a partial hospitalization setting. Now he's passionate about advocating for those afflicted with mental health issues and is in the process of starting his own business and helping the IOCDF launch an affiliate chapter in Iowa, which we're very excited about. That's awesome. Those who struggle with scrupulosity, both religious and moral, are particularly close to Micah's heart because he was at Bible college and planning to go into vocational ministry when his own scrupulosity began years ago. So I know we have so many here that that can relate to the struggles of those who are joining us and those who will watch later, and we're excited to dive in. So I'm going to go ahead and start asking just a few questions to get this panel going, but I would encourage you to put questions in the chat. I'll try to get through as many as I can. I'll start with some of our own questions, but I will go back up and make sure that you're posting questions, posting maybe experiences that you have, because we would love to engage you in this important conversation. So first, thinking about faith and OCD, Valerie, I wanted to start with you as someone who's doing so much of this amazing work. How does OCD impact an individual in a faith community? What does that look like? Well, maybe what's your experience been with that?
It's very impactful. I think for me personally, especially being a Christian, it impacted how I viewed my relationship with God and my fellow members of the church. It impacted to my own self worth. Am I worthy enough to be a Christian? All of those kind of things, emotionally, mentally, I questioned where I hadn't questioned before. So I basically can say it probably impacted every phase of my life, even beyond being a Christian. And at the time when I first started, before my diagnosis, or during my diagnosis, I should say, I had an incident where I was teaching Sunday school, adult Sunday school. And this was prior to real fully understanding how OCD worked. And in the middle of teaching Sunday school, my OCD decided to, show up and challenge me. How dare you be sitting up here teaching these people, about Jesus and you yourself, having all of these thoughts. So it was very impactful. It was so impactful with that incident. I remember going to my pastor's wife because I was crushed. I didn't understand what was going on and, having all of these thoughts. And like I said, in the middle of Sunday school, teaching adults, what do you do? And I just literally froze. And I was fortunate enough to be in a church body that somebody was able to just walk in and take over. But it was devastating. And I was at the point where I wanted to quit teaching. And it was because of talking to my pastor's wife, who kind of shared with me some things herself, that I was able to say, okay, let's keep it moving. But it totally impacted my relationship the most distinctive thing that I was worried about was my relationship with God. Was I worthy to even be called a Christian?
Yeah, Val, thanks for sharing that. And I think this can be so challenging. And as so many know, OCD really latches on to the things that are literally the most important and are the most crucial in our lives. But I'm so thankful through that journey that you had a supportive faith community. And I know that that makes such a difference. And some of the work we're trying to do here is to make sure that everyone has that support in their faith communities. So I'd love to ask Micah a little bit about what your experience is with this too, and kind of how OCD impacts individuals in faith communities, but also is there stigma within faith communities around OCD, around mental health? What does this look like for you?
Yeah, so I mean, I'm coming from more of a conservative evangelical background. That was my primary experience. But yeah, I would say there is so much stigma and so many misconceptions. I think Valerie hit the nail on the head mentioning the multifaceted nature of the struggles. I mean, it's relationships with other believers. It's being misunderstood by pastors and elders. I think one of the common stigmas probably is that, at least where I came from, is the idea that somehow people with OCD, struggling with anxiety, struggling with mental health issues, somehow this is a sign of a spiritual issue. Maybe there's some sin in their life that they need to, be more honest about or work through in some way. Or another, stigmatic misconception that I ran into often was this notion that I was trying to be an instigator. When I certainly wasn't. I think sometimes OCD gets us really caught up on some of these meticulous, tangential matters. And to the OCD sufferer, this is really concerning. This is really overwhelming. And maybe to a faith leader, it feels like you're just trying to pick a theological debate. They don't really see the relevance. And even if they do see the relevance of what you're saying, the intensity with which you're concerned about the matter feels really out of proportion to a member of clergy who doesn't suffer with OCD. So I don't want to go on forever and ever here, but I think it's really endless, the amount of areas that untreated OCD can mess with your own personal faith, your relationships with others, or even get in your head about how the community feels about you. And it goes on and on. So it's just so important to get connected to the right resources when OCD is starting to mix with religious issues.
Yeah, Micah, I think that's so important, and what you're bringing up too with this idea of sometimes clergy not knowing or not having the resources. I see this with students from different traditions every day of, hey, I'm navigating this thing, whether it's OCD or depression or something else, and I told my faith leader, and they said I need to pray harder. And we see it across the board in different traditions, and I don't think it's really in malice. I think as a faith leader, I like to think that we really are trying to help folks, but I just think there's this lack of knowledge, and excited to share later in this panel today some of what we're trying to do with conferences and things like that are coming up, so that folks don't have the experiences that Mike is talking about. So I think this is a great transition into the importance of maybe faith leaders and mental health professionals working together. So Jed, I would love to ask, how can mental health professionals and faith leaders work together? And maybe you can talk a little bit about, for anyone who doesn't know on here, what the first line treatment is for OCD and how faith leaders might help make that jump from faith concerns to mental health concerns.
Yeah, so those are, of course, really important considerations. And many times I find that collaboration between clergy and mental health professionals can really, really help people with all of the kinds of complications that everybody's been talking about already. But it takes a little bit of trust in the collaboration, because of some of those stigma-related kind of ideas and others as well. And sort of being really transparent and clear about what goals are sometimes. And so, for example, the first line treatment for OCD is exposure and response prevention, or some variation of that. And that involves facing your fears and intentionally doing the things that trigger obsessions and refraining from doing the compulsions and those sorts of things. And so, mental health professionals don't have the authority, the religious authority sometimes, to speak about certain things. And clergy often don't have the knowledge or the understanding about the treatment. But they can really, if they can collaborate together, they can find ways to disentangle the OCD from the religion and to violate the OCD without violating the religion or without violating people's actual values. And that can be fantastic and could be hard for either one to do on their own. But it's not for no reason that there are faith leaders who are skeptical about psychology, sometimes as a field, or psychologists, academic psychologists, certainly, that we have a history that's, I say as a clinical psychologist, have a history in the field that is not necessarily great with some of these things. The way Freud, even going back to Freud, talked about religion, it's an obsessional neurosis and that sort of thing. And it's also the case that clergy are not normally trained, I guess you might say, or their way of thinking is not normally like, what can we get away with here? That's a weird way to look at religious questions. And so a lot of clergy, I think, default to thinking about ways to circumvent potential problems. Like, what could you do to be safe? Or why would you try intentionally to push the limits of sin? And from an ERP perspective, we understand pretty well. We want to violate OCD. We want to go as far as we can to violate OCD without violating the person's actual values and their religion. But that can come across as disrespectful if you're not sort of clear about what the goals are. So helping clergy, if you're, let's say, a therapist, helping clergy understand your goals, not to ruin somebody's religion. To the contrary, my own data show that most people with scrupulosity experience their OCD as interfering with their religion and with their relationship with God. We're trying to help people get rid of that so they can live the lives that they value, so they can live a life in service of whatever, religion, God, whatever is important to them, not in service of anxiety reduction or in service of OCD. And the way to do that is to find where the line is, violate OCD, so that we can get rid of OCD from religion, not so we can wreck your religion for you. And so but it's a little bit of a paradigm shift, I think, for clergy, and probably a mirror type paradigm shift for therapists as well.
Yeah, I think what you're talking about is so important, and this relationship can be so tricky sometimes between clergy and clinicians, and yet is so incredibly important as individuals live into their religious values, but also receive that treatment that they need. And some of, again, what we'll talk about a little bit later is how we're hoping to put out some resources for different faith leaders in different religious traditions, whether individuals are Jewish or Christian or Muslim or Sikh, so that individuals are able to share with their faith leaders a little bit more about what ERP might be, what they're doing in those areas, so that there can be some collaboration between clinicians and faith leaders and communities. I have some other questions, but actually we have some great questions on here that I would love to go ahead and dive into. So at 11:12 a.m., Hope says, I become afraid of being judged, so I stay away from my own religious community. Do you have some tips on how to overcome this OCD issue? And Hope, you are definitely not alone in that. Before we got on just a second ago, Micah and I were having this exact same conversation. So Micah, do you have any thoughts on this? Do you have some tips on how to overcome feeling like you're going to be judged in your religious community, feeling like you can reintegrate with your religious community? What does this look like for you?
I think it may not be the answer everyone wants to hear, but what I had to do was really accept that the path to me getting better was going to involve a type of therapy that not everyone in my faith community would agree with or understand. And so I think for me personally, I mean, everybody has to work with their own clinician and decide what recovery is going to look like for them. But for me personally, I had to have some acceptance about the fact that, you know what, I have looked into the different ways of going about treating my scrupulosity. I've tried some things that people said would work and it didn't work. And I've had some research, like ideas backed by research, namely ERP, presented to me as another option. And I was scared of it. I was hesitant at first. My own conscience was a little bothered by it at first. But I really saw that there was data supporting that it was working. And so I decided that I think the main overarching idea that pushed me to ERP, in spite of my hesitance, was God wants me active in my life. God wants me living out the desires I have to serve him and to do something with my life. And scrupulosity had gotten me to a point where I was not doing much of anything productive anymore. I was just like Jed said, I was just serving anxiety reduction. That was, really a large part of my existence. And so I just had to accept, you know what? Not everybody's going to approve here. Not everybody is going to think that what I'm doing, because I came from a super conservative background where some people didn't even think OCD was real. They were not just contesting maybe the way I was going about it. They were even contesting whether that is even a legitimate thing or that's just a spiritual issue and the secular world just calls it OCD. So I was dealing with a lot of pushback, and I just had to accept, you know what, I will be judged by some people, but that's something I have to be okay with. And there will also be people that will support me. There will be people that will see the interconnection between faith and mental health, and they will be supportive of me. And I clung to those people and had to be okay with people that had a different opinion. And that's really hard because, with OCD, every person that doubts what you're doing introduces more uncertainty of maybe I'm going the wrong way. Some people in my faith community don't think this is right. Some people do. So I totally empathize with that sentiment of I want to be accepted. I want everybody to be on board with what I'm going through and how I'm seeking treatment. But the real freedom for me personally, anyway, came when I was willing to just gravitate towards those people that support me, and be okay with the fact that some people might not.
Yeah, absolutely, Micah. And I think that can be really tough. At least for me with OCD, I tend to be a pleaser and I want everyone to like me. I want everyone to approve of what it is that I'm doing. And that can be really, really challenging in navigating this within faith communities. Yeah, Valerie, what do you think about this?
Yeah, I can really relate because going back to the question about how it impacts us, one of the ways that it does is it stops us from wanting to seek help. Because I know in my circumstances in the beginning, it's very hard when you feel that you're being judged and convicted with just hearsay, and it made me more conscious of it, and also the need for me to try to educate my pastor and those that were important to me that it is a medical diagnosis, and that once they kind of understood that, it was easier not to feel so much judgment. It was not easy. It probably took plenty of conversations and being open. And I think with myself, because being older and within my own congregation, I had been there for so many years, it was easier to talk and express what I was feeling. But basically for me, I think it was the lack of education. They have no idea what OCD is. You have all of these myths. But for me, it was very important for them to understand that this was a medical diagnosis. This wasn't what Valerie was thinking, or it wasn't a demon, and all of those sort of things. So once they kind of got the gist of that, I felt very open and loved and appreciated for being able to stand in my own truth, if that makes sense.
Thank you, and hope. I hope that these responses give you a lot of hope around this, because I think, at least for me as clergy with OCD, one of the things that makes me the most sad is when individuals are in this space of feeling like they have to choose getting the help that they need to live into their faith, to be the person that God has so beautifully created them to be, and actually having that faith. It's like this thing that you don't need to choose between. And I really hope that you're able to re-engage or engage with a community that's important to you and do the treatment that you need, because those two things can fit together. And I think sometimes even your faith can be a value to give you motivation to do that treatment that you need. And but it can be really tricky. So we are definitely with you, Hope. Neil Chris, at 11:12. Neil, it's awesome to see you. We're excited to have one of our awesome advocates on here. He said, I think the most asked question I get is, how did you keep the faith? So whatever faith you hold, how have you kept your faith throughout your years with OCD? And Jed, I know you work with a lot of different clients navigating this. How have you seen individuals try to balance between keeping their faith, doing this treatment that's really, really hard? What does that look like?
So different person to person. I'm having trouble coming up with something that could really cover that question. Well, it's so different for people. And what really just strikes me is what you just said, Reverend Katie, which is that it's just such a shame when people feel like they have to choose between effective treatment and their values and faith and goals. And we choose what we believe to a large extent, but also some of it changes a little bit outside of our choice. And certainly struggles with things related to OCD and communities and stuff can influence that. So I think, as a therapist, as an OCD therapist, I want to help people pursue the things that are important to them without deciding what they're going to pursue because of the OCD or because of the anxiety. And so when faith is important to somebody, and for many of my patients who struggle in this area, it's not even on the table for discussion, right? It's a given. So then I'm not even sure the question is quite that way. Like, how do you keep the faith? The faith for a lot of them is like, that's for sure. And then what can I do, if anything, to get rid of the OCD? And of course, what you're trying to say, and I agree with 100%, is you shouldn't have to choose between those two. And there should be no sacrifice there at all in terms of what's important to you. So I feel like that's an inadequate answer, but I don't know how to work with somebody to keep their faith when they don't have their faith and it's complicated by OCD or something like that. More clarifying and identifying what you do believe, what's important to you, and then finding ways to disentangle OCD from those things and to really almost frame treatment as a way to pursue your values. It's so hard. Micah told us a great story about how much the OCD wrecked these other areas of his life for a time. And we want to not have to sacrifice the other things that are important to you for the OCD, but instead to fight the OCD and cut it out.
Absolutely. Go ahead, Val. I know you have some thoughts on this too.
Yeah, because I can so relate. But I think for me, it came with the growth, and it came with me realizing as an individual and as a Christian that we all have a cross to bear. And I didn't get to choose, what cross I wanted to bear. It was given to me. So once I kind of accepted that, it is what it is, it allowed me to not worry so much about what other people thought. And like I said, it came with growth. There's nothing that happened, just like that. But because I realized that I didn't get to choose, what cross I needed to carry, but I do get to choose how I carry the cross. And that made a big difference with me. And so it allows me to stay hopeful and to keep moving forward, because like I say, everybody has something they have to bear. And we can't, it goes back to, feeling like you're being judged, like, oh, well, OCD is nothing. What kind of cross is that to bear? But it is. And once I allowed myself to get to that point, it's been a lot easier to remain hopeful, because that's the whole purpose of this talk, is to encourage everybody. There's always hope, especially from a perspective of religion. Without hope, there's nothing. So stay encouraged. You just have to keep trying.
Thank you, Val. And I think that is so hopeful and leads so much into our next question at 11:15. It said, my question to Katie, I want to know the OCD understanding from a Christian point of view. I mean, how Christianity sees OCD. And I think this is tough to answer because the Christian point of view can be a lot of different things. Just like all of our religious traditions, there's a big perspective where some within the Christian tradition understand OCD and maybe some don't. And there might be some different theological kind of undertones with that. But I would say, at least from my perspective as clergy, I really believe that God doesn't create brokenness in our lives, but God uses the brokenness that exists in order to create beauty. And God always creates beauty out of brokenness. So for me, I understand that OCD, for some reason, a reason that I don't fully understand, is a part of the things that I've navigated. And I believe that God is able to give me bright spots to help me do something with that really hard thing. And I don't necessarily blame God for that or see it in that way, but for me, even bright spots over the last week with advocacy and talking to students about mental health and being able to use experiences with ERP and with faith and with OCD to inspire others. I think from my faith perspective, that's what it looks like. God being able to offer us opportunities to find beauty in the brokenness. So I'm not sure if that entirely answers your question, but for me, that's what that looks like. And I think for many clergy, while they might not fully understand everything that folks with OCD navigate, there really is no shame around that. And it's just you seeking to be you in the best way that you can. Yeah, go ahead, Jed.
Yeah, I just wanted to add one more thing that occurred to me as you're talking about this issue, which is I don't know that the question about faith here is unique. So imagine somebody who has OCD, and because of that OCD, they are struggling with whether they want to have a kid. Whether they want to be a parent. Let's not, actually, I should rephrase. They're not struggling with whether they want to. They desperately want to. That's what they've always wanted. They want to very much, but they doubt their ability to because of their OCD and are considering not doing something that's so important to them because they have OCD. And so, if you sort of reformulate that question as being about faith, how do you help somebody keep their behavior and desire to be a parent, let's say, even though they have OCD and are really struggling. And I think it's almost obvious in a case like that to just about anybody, I would imagine, anybody who knows something about OCD anyway, that it would just be a terrible piece of advice. It would be such a shame for a person's life to give up something so important to them to try to accommodate their OCD. And we know very well that being religious doesn't make you have OCD at higher rates. Being a parent doesn't make you have OCD. Yeah, there's postpartum OCD and that sort of thing. And if you have OCD and you're a new parent, it's probably fairly likely that you'll have some obsessional content that latches onto it because it's so important to you. But are we going to tell people that you can avoid your OCD by just not having kids when that's important? First of all, it's so important to you that would be just like, it seems like a terrible sacrifice. And also, you can't run from your OCD. So your OCD will latch onto something else. That's not the reason you have OCD. And it's the same thing with faith. It just seems like the wrong approach and an ineffective approach at that to try to fix OCD, whether it's Reverend Katie, like you were saying, people saying just pray more or something, that's not going to fix it, or run away from religion and give it up, then it'll latch onto something else too. So you can't run and you can't hide from it, and you don't want to live a life that gives up the other important things to you.
Yeah, absolutely. And it's opposite action. The biggest exposure is when you get out of the therapist's office and your exposure is living your life and doing those things that give you so much joy and that bring you so much value despite what your OCD is saying in the process. And I know for me, yeah, it's attacked faith, it's attacked work with students, it's attacked everything that I possibly love. And I think over time, it's been really helpful to think of something I've heard on some other streams on here, this idea that whatever your OCD is attacking, it's probably because it's something that's important to you. And my biggest way of exposing myself to that is to just do that even more intensely. All right, I'm going to spend even more time with kids. You know what? I am going to live into my faith even more, regardless of what the OCD says, because that means something to me. So we have a question at 11:23, and Jed, I'm going to throw this one to you as well. It says, what are your thoughts for recovering alcoholics saying that they should get down on their knees every day to help stay sober? I'm not a religious person or spiritual and do not have scrupulosity OCD, but have perfectionism, intrusive thoughts, and a checker. But they're just asking, how do we help these people? It seems like who might be navigating AA, who might be navigating religious programming, who also have OCD.
So people who have OCD and
it sounds like might be in programs that use faith as a part of recovering from alcoholism.
Yeah, so I guess it's not obvious to me why those things would contradict, except if there's something about that messaging that the OCD has latched onto as well. Certainly not everybody loves approaches that are so religious, like AA kind of approaches, but they also certainly work for some people. And they are often in their regular form pretty religious, and so works often better for pretty religious people. And so I guess the question is, what if somebody also, if the religion then becomes a source of anxiety in the context of OCD? The truth is, I think about these things just because of what I do all the time in my own background. I think of these things from a very OCD-centered perspective, I guess, and I don't do a lot of substance-related stuff. So I would actually, with that huge caveat, which is certainly a huge one, to me, I would sort of hope that there's a way that somebody could meet what they need in terms of the substance use dependence problem without having to sacrifice effective OCD treatment also. I can't imagine there isn't. But it's hard for me to picture exactly what messaging in that, getting down on your knees to help stay sober would be a problem. If it's just religion, again, with OCD and scrupulosity, the problem isn't religion. The problem is that OCD has latched onto religion. Just like, the problem isn't sex if you have sexual obsessions. The problem isn't, appropriate kind of cleanliness or something if you have contamination obsessions and that sort of thing.
Thank you. I think that's a perfect answer. It's kind of reframing what the actual issue is in that space. Thanks, Jed. We have a great question I'd love to throw to Micah from 1131. Barbara Wall says, how do you address the belief my friend is having that God is punishing him through his OCD?
Yeah, I think, for me, I struggled with believing at times, and I think the OCD kind of encouraged me to worry that, OCD was either the result of sin, or why is this not happening to many of my other Christian friends, but all of a sudden it's getting in my way. And I can relate to a sense that it was tempting to feel like, why is God doing this to me? I mean, I was a Bible college student at the time. I was going into ministry. It's like, I'm trying to do good by the Lord here. And now this is happening to me. And I can't speak for the friend exactly. And they need to decide what they believe and work through things in their own treatment setting with a professional. But I would say that, just to be supportive and caring and loving of someone, and to try and, embrace that sense of OCD, as it's been explained to me in treatment, is a physical problem in the mind. There are biological connections to this issue. And I think whether it was me doing it or my people I went to church with doing it, anytime we try to create spiritual meaning, particularly in a negative way, out of OCD, and say, well, God gave me OCD as a consequence or whatever. I just think it was so helpful for me to just accept what I was being told by professionals, that this isn't all spiritual, and I don't always have to come up with some theological reason for why I have OCD. And I think it relates to a little bit about what Reverend Katie said earlier, talking about, what a Christian theology of OCD and mental illness, and saying, yeah, I do believe that God makes beauty out of ashes. But I also believe that we live in a fallen world, and, I don't look for spiritual meaning in my high blood pressure. I take the beta blocker that I'm told by my doctor to take, and I move on with my life. And for some reason, I looked for all sorts of spiritual and theological meaning in my OCD. And I think treatment just taught me that, that may have been a mistake. I need to, do what the professionals that were on my treatment team told me to do. I take a medication to help my brain balance these issues, the same way that I take a med to help my heart get into the right rhythm. And I think that has given me more freedom than looking for spiritual and philosophical explanations ever has.
Thank you, Micah. And I just love times 10,000 kind of your answer of not looking for some sort of spiritual meaning in your high blood pressure. And I think, what a great analogy. I absolutely love that. Val, do you have any thoughts on that too? How might you address the idea that an individual is being punished by God through having OCD?
Well, I agree with everything that Micah said, but I think too it goes back to the church body in itself not understanding what OCD is, and I think too. Dang! I lost my thought. I think also that we just have to come to your own terms. Like he said, that nobody questioned. When I broke my foot, I was in a car accident 7-8 years ago. Nobody questioned why I was taking medication. Nobody told me, oh, you need to make sure your doctor is a Christian. None of those things, because it's seen as a liable treatment, or a liable I won't say disease, but medical issue. And it kind of reminded me, I read this book by Amy Simpson. I can't remember the title of it, but she spoke about kind of the same thing. It's like OCD in the Christian world, it's like the modern leprosy, because we don't understand it. We want to get away from it, or we want to deem it, all these things that is not. And it's the only thing that's not given much empathy through the church. She calls it the no casserole disease. I mean, when I broke my foot, people were willing to cook for me. I've seen people that when you have a baby, they bring you baskets, all of this stuff, except for if you mention you have a mental illness. And it's because it goes all the way back to all of those factors we were talking about, judgment. I think the church is very fearful of us feeling that we're outsourcing Jesus, that we can't do both. And that, if we decide that we need therapy, it better be a Christian, because, the world over here is going to tell you something different. And none of that is true. And then because of that adds on the pressure of, okay, am I being punished by God? Because all those other medical conditions don't have those things. So it's just a learning point that you have to get to. And that's why I stress so much to my own community that, it's a medical diagnosis. It's a medical diagnosis, no different than, taking your high blood pressure medication. And I think until that conversation happens, that there's always going to be that issue. And last thing I was going to say too, and just from having OCD, that will probably always be part of you. when it comes to faith, that you might get those feelings that, God is punishing me, but we just have to realize that he's not. He's a loving God, and I think too, going back when she talked about the treatment of always as having to pray, talk before you approach anything. It goes back to that same stereotype that I was saying. Our fight is not necessarily on our knees, because we have that relationship with Christ already. Praying in a way is not going to, praying about it more, it's not going to make it go away. It has to be treated. And because of all of those things, it can lead one to feel that way. And it shouldn't be like that. We should be known by love, not by, she has OCD and she needs to pray every day. No, it has nothing to do with your faith. And final thing I want to say with that, I find during my toughest days is when I'm drawn closer to God. And it's when I feel him more. I don't feel the punishment. I feel the support. I feel the love. I feel the encouragement. Is me that that puts that pressure to be the perfect Christian, or to be able to pray it away, or have all of these conditions I need to meet before I can talk to God. We wouldn't need him. If it all goes back to, like, say, just being a sinful world is always going to be there. OCD will always want to challenge you regardless of what it is. And you just have to keep trying to stay forward, stay on that battlefield, keep moving forward. But it's going to be a battle, but we have to concentrate on winning the war. And for me, like I said, I first got diagnosed in 2011. So I'm talking about a 10-year journey. This didn't happen overnight. Not saying it can't, but because everybody's walk is different, your treatment and how you approach it probably will have to be different also. So stay encouraged. Tell OCD to shut up.
Thank you, Valerie. We love that, and you are such a warrior in this area with your faith and your ERP. And I think there's a lot of folks who are giving a lot of accolades in the chat right now that really meant a lot to them. So thanks, Val. Go ahead, Jed. I think you had something to say.
Yeah, I just want to amplify a couple of those points and add on one thing. The notion, I think, respectfully submit to you all for your consideration anyway, that the notion that OCD content that has latched onto religion, so scrupulous content, has any more theological meaning than OCD content about anything else, I think is itself incorrect. It's just like, sexual content is not necessarily a sexual problem. It's an obsessional problem. And so we don't need to, and we can't solve age-old philosophical and theological problems like, why do bad things happen to good people? I mean, for centuries, millennia, people struggle with that and write about it and think about it, and they will forever. Because bad things happen to good people, as best we can see as human beings anyway. And it's OCD masquerading as religion. If somebody is hand washing 60 times in 20 minutes, we're not saying they're very clean. This is an issue of cleanliness. Again, we're saying this is compulsive behavior. And so OCD can masquerade as religion. It doesn't make it a religious issue. It's almost the same problem that we talked about at the beginning with some of the stigma-related issues of people saying, pray your way out of it, or this means you don't have enough faith. It's not a religious issue just because OCD has latched onto religion and religion is important for you. Not a religious issue, at least in the sense that it doesn't get like privileged theological implications. You can wonder why you're suffering so much with any kind of OCD or any kind of anything. Like Micah was saying, blood pressure, cancer, genocide. There's horrible things that happen to people that we can't understand, and all of those are theologically problematic and relevant for sure. And the fact that your OCD content is about something important to you and that thing is religious is not a bigger problem. And so for folks who are struggling with that, I'd suggest that you try to reframe that. You're not going to solve the issue of why people suffer, but it's not a bigger problem that your suffering has latched onto this thing versus that thing, to my mind anyway.
Yeah, Jed, I love that, and you're right. The theodicy question and why do bad things happen to good people is an age old question, and really it isn't necessarily relevant for our conversation. It's just how are we going to continue to move forward in this area? And just because something is theological or connected to your faith doesn't mean that it's any more significant. And again, we've said this a few times today that your OCD literally latches on to the things that are the most important to you. It doesn't mean that content in and of itself is the most important. It's like you're giving it that importance. And if you're sitting there and thinking, well, this one has more meaning because it's about faith and I can't do ERP, I can't let this one go, that's probably an even better reason to live into that uncertainty. Because I know for me, every single theme that I've had, it has felt like something horrific is going to happen if I just let whatever take place, if I don't respond. And every single time it feels real, and every single time it feels different, and every single time it feels like this is the thing that is the most important to you, and how could I possibly let this one go? And for so many here today, that is what relates to faith. And the biggest kick in the pants that you can give your OCD is to not treat that content any differently than any of your other content. It's not different just because it's about faith. It just happens to be something that's really important to you. So I think going along with that, we have a really great question at 11:45 that someone talking about their son who is at age 16, who goes to a Christian school. And it seems like he's feeling like he needs to have more faith in order to navigate some aspects of his OCD. And it says, how do I balance his relationship with God without making him think that God will all of a sudden stop his OCD? Any thoughts on that? How do I balance his relationship with God without making him think that God will all of a sudden stop his OCD?
I think I would just pitch in, I grew up in the evangelical environment. And I know one of the things that I hear this question personally, because one of the things that I was encouraged by a lot of people in my faith community is that, we want healing for you. We want God to take this away. And people often mean well, but it can unintentionally create this idea that you'll know God is okay with you when this goes away. And the OCD's presence then becomes this sense of like, am I not doing something right? Is God going to show his love for me by taking this away? And like you said, he is asking this question of, well, maybe if I had enough faith, then things would be different. And I would say, as a parent, this to me is a perfect example of the need for there to be collaborative effort between clergy and mental health professionals. I mean, make sure that your son is working with an ERP specialist. And if you can, have your son's pastor also be communicating with that therapist, because that's the difficult part about scrupulosity. Is a lot of times there are mental health issues that need a trained professional, and there are also issues of soul care going on, whether it's thoughts about suffering or whatever, that really need pastoral leadership. And I wish when I was 19, 20 that I would have had that, because what I ended up having was either a therapist saying, we're going to try to treat this way, or it was a pastor saying, we're going to pray this away, we're going to do this, that, thing. And what I needed was both. I needed someone to work with the OCD at an ERP level, and then I personally needed a pastor to help me understand, God may be asking you not to just put your life on pause until he takes OCD away, but learn to trust him as you live with this disorder. And that was not an option that my faith community was putting in front of me very often. I was not regularly encouraged to think about that just because God is good and God is loving doesn't mean that I get a life of no challenges and no setbacks and no problems. And we live in a sinful world, and the fall affects a lot of things. And unfortunately, the human mind is not exempt from those potential issues. And I really had to digest that. And so I would just really encourage you as a parent to get your son connected with a good spiritual leadership, and also a ERP specialist to help him get that multifaceted approach that I wish I would have had, and would have accelerated my recovery dramatically if I would have had that opportunity.
Thank you, Micah. And I think this leads us so nicely into the last question I'm going to ask today, but definitely hang tight, because I'm going to tell you about some exciting initiatives that we have coming up to address all of the things we've talked about today. But we have a great question at 11:52 that I would love to throw to Jed. And it says, my therapist has suggested exercises that are outside of my values and my community's values. Any thoughts on navigating that?
So mostly what I want to say is that you should be able to find ways to violate OCD without violating your values. And that if the only things you struggle with, let's say, are normative, let's say religious practices in your religious tradition, then maybe you have some conflicted feelings about religion or about God. Lots of people do. And that's okay. I'm not even sure that means that's OCD though. And so that's usually how I would answer that question. I will add though, that sometimes when people use the word values in this kind of context, their OCD is coloring what they mean there as well. So for example, if it's important to you to be honest, reliable person or something like that, and you therefore won't say anything that's even ballpark a little bit, you won't say like, I'll be there in 5 minutes, when maybe it's going to be 5.5 minutes or something like that, even though I think for most people that wouldn't actually violate like a religious prohibition, and that would, but it's like, but my value is honesty, and that's somehow not in the spirit of honesty, then I might challenge you to reconsider that boundary and whether or not OCD is coloring that, because you are looking for ways to violate the OCD without crossing a line. When it comes to religion or other kinds of values. But if what you mean by values is really normative religious practice in your group and for you, and you're not exceeding norms and standards and that sort of stuff, then if you have, let's say, scrupulosity, then there must be stuff that's exceeding what's normal for folks, co-religionists, I guess, or whatever, folks in your group. And then I think you might just need some creativity to find ways to violate the OCD rules without violating the values.
Thank you, Jed. And I think this is a great way for us to close out and share some of the initiatives that we have coming up to continue to address this. I think some of these conversations are so important to have between individuals with OCD and clergy or faith leaders, and also clinicians, for us to have this conversation together about how can we do this effective treatment, live into our values, have faith, all of these different aspects that feel tough to juggle. So the IOCDF has been working really hard. We have an awesome group called the Faith Task Force right now, and I'm working on that with Valerie, one of our fantastic lead advocates, and Jed and Micah have just joined us on that as well. And some of the things that we're doing to address this come by way of an upcoming conference. So we have a faith and mental health conference on May the 21st. And it's our first ever Faith and Mental Health Conference. And the best part of this is that it is free. So yes, it is free. You can get all of these resources for free. And the idea is that we're bringing together a diverse group of faith leaders, therapists, and those with lived experience to have these types of conversations. I know that we will all be a part of that. And I had a lot of questions in the chat today also about, I even saw some things on Judaism and how do I get this in the hands of my religious leaders or my religious practitioners? Know that this is something that's open to individuals and faith leaders and clinicians who are Jewish and Christian and Muslim and Buddhist and Jain and Sikh. And we really want everyone to participate. And we're going to have representatives who are able to help us navigate these issues in different communities. Along those lines, in order to best serve the community, we also have an anxiety and faith-based communities needs assessment or survey right now. We would love, love, love your feedback as either religious leaders, as clinicians, as individuals with OCD to help us as we shape some of these initiatives to address all of these concerns. Some of the things that we're hoping will come out of this this survey are some upcoming additions, maybe to, I know someone asked about anxiety in the classroom. We're working on some additions to the website to offer resources, not just to one faith tradition, but to different faith traditions as we seek to have conversations across the lines of religion and mental health. We're also working on some videos with different faith leaders, as well as some groups for individuals to come together to have these conversations. So lots of things in the works that we are so excited to share with you. And finally, outside of this realm, but still important, we have our anxiety in athletes survey that we would still love for individuals to take as coaches, as athletes, to help with those initiatives. Tom and Ethan had a great talk on that last night, and lots of things launching in this area. So please contribute to that as well. And finally, you can feel free to join the Peace of Mind virtual community at iocdf.org/peace of mind. And you can view the live stream schedule, submit topics, submit questions for future events, so you can continue to engage in this awesome programming. As always, you are more than welcome to email info@iocdf.org to share any thoughts that you have, also to ask questions, to connect with any of the panelists. You are also more than welcome to email me directly at katie.odunn@gmail.com if you are interested in having any conversations, especially for clergy, on what it means to be clergy, navigating mental health, any of those things. So as we conclude this time together, just know that we are so thankful for everyone who is here today. We're thankful for everyone who will be watching later. So thankful, of course, to Micah, to Jed, to Val, and to our awesome community behind the scenes with Fran and Chelsea. And just please, 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 everyone know that you are loved, that you are not alone, and that you can have faith, whatever your faith tradition is. You can live into that beautiful faith tradition, and you can seek treatment for your mental health to be that full, beautiful, amazing person that God has created you to be. So, thank you, everyone.